Hello and welcome to the podcast series sponsored by Aster Hospitals. I'm your host, Pallavi. This episode is all about gut health. How to keep your gut healthy, the good gut bacteria, the bad gut bacteria, the gut-brain axis, and how a happy gut truly means a happier you. Let's understand all of this in today's episode. We speak to Dr. Satyajit Godhi, Senior Consultant, Laparoscopic and Surgical Gastroenterology. Thank you for joining us, Doctor.
Thank you for calling me.
We all know that gut health is important.
Yes,
right?
yes.
Could you please explain how gut health, like having good gut health, helps in overall good health?
Of late, in the last 2-3 years, you have seen a lot of influencers, a lot of people, film stars coming out with what I eat, what I don't eat. This is my routine.
Right.
And as a gastroenterologist, it is exciting because finally the gastrointestinal tract is getting the attention that was lacking all this while. I always tell everybody that you are what you eat. So whatever goes inside actually makes you. So you eat crap, you are eventually going to be crap. So gut health has become very important, and I'm very happy that people want to know about how to keep themselves healthy, and it all starts with gut. Every calorie you get for your daily activities comes from what you eat. So it is very important. It is as important as using a good oil for your car or a good quality petrol for your car.
So how does one know that now these are the symptoms because this person has bad gut health?
Often if you ask the common symptoms, they are bloating, burping, farting, and bowel health, that is passing motions, how frequently they are passing or how infrequently they are passing. So these are common symptoms that may indicate that there is some problem.
Okay.
And it's not going right. Either you're not eating right or there is some problem in your intestinal tract which is causing these symptoms. So these are the common problems. Pain is of course always there.
But doctor, we don't have the natural process of fermentation.
Yes.
People go for alternatives, readily available probiotic drink.
Yes.
Do you recommend that?
So if you're somebody who has a reasonably good gut health, you really don't need extra probiotics from what you're getting from your meals is more than sufficient. So naturally, I mean, very often I advise everyone to have curd. I mean, it is so easily available, cheap. You can make it at home. You can buy it from outside also, and that has a lot of probiotics. It can fix most of your problems. Often we don't include curd in our diet. Maybe 1 cup or half a cup in a day. That's too less. I advise 1 cup of curd with every meal. Just have it, just like that.
On the contrary, they say that do not eat curd in the night because it's heavy to digest.
So most of these concepts of don't eat this, it causes some heat in the body and cold and all. Scientifically speaking, that's not what happens.
Okay.
If you're not lactose intolerant, then you're lucky, and you should have curd because that's the easiest probiotic that you can get anywhere, and we should inculcate curd in as part of our daily meals. There is a old tradition that people after eating everything eat curd rice.
Talking about gut health also leads to fasting. We know fasting is very good. We've been practicing it from centuries.
Yes.
But the trends keep changing. Sometimes it's in trend, sometimes it isn't. One such thing is intermittent fasting.
Yes.
It helps in diabetes, it helps in so many other things, yes, for sure.
Yes.
Does it also help in good gut?
So as you rightly said, fasting has been part of a tradition.
Right.
People fast on Tuesdays, on Thursdays, and people find various reasons to keep fasting. And there is a reason for that. Again, most of our traditions are scientifically based. So fasting would obviously keep you lighter, help you control your blood sugar, keep you more healthier, active. So I am completely for fasting. But when it comes to fasting, even traditional way of fasting on those days or intermittent fasting, there is a primary requirement that your gut should be on track. Only then you can venture into these things of fasting and intermittent fasting. But
irrespective of whichever the fasting that we do.
Yeah, whichever, for whatever reason you are doing. Primarily, let's say if you are a person who is having some gut trouble, bloatings and farting or acid reflux, and in general you are not too happy with the way your gut is, And when those people start doing fasting, intermittent fasting also, they often tend to worsen their problem. So intermittent fasting is good, but it is only good for people who have more or less a good gut health to begin with. And then you do intermittent fasting, you get all the benefits out of it. But for somebody who is kind of having acidity every alternate day, for that person to do intermittent fasting is going to be very difficult. He's going to increase his symptoms. So my advice is, before you jump into intermittent fasting, just know yourself as a body, as a gut. If you're more or less happy with the way things are going, then you can do intermittent fasting and get all its benefits. But it's not for all. So that's what I meant. You should, if you are primarily a person who is farting, bloating all the time, don't do intermittent fasting. It's not for you, definitely.
Few minutes ago, we also spoke about acidity,
Yeah.
right? Why is it caused, doctor? Is it because of the kind of masala food that we Indians eat, or is there any other reason?
So it is partly both. A person, let's say, who is having a slightly more, who has a taste for these slightly more spicy foods, tend to get acidity problems more. People who eat more junk food and fast food, they tend to have more acidity. When you consider people who are more eating home cooked food, for example, all 3 times a day, they tend to have lesser tummy problems. So it is again dependent on your way of eating, plus as a body what you are. For example, if you're somebody who is overweight, no exercise, sedentary life, smoking, alcohol, just partying every time, you're bound to have acidity again. So it is a mixture of what you eat and how you are as a person as well. So it is a slightly complex way of trying to understand why it happens, but it has multiple reasons of why it starts happening.
Okay, I want to ask you, how do we treat it? But before that, I also want to understand, is all heartburn means acidity? Is there a difference? Please correct me.
So often when we talk about heartburn, what it actually means is burning in the chest. Okay, so there is a food pipe here which goes to the stomach, and when the food pipe burns because of the acid, that causes something called as heartburn, which we commonly call it as heartburn, but is burning in the chest. Basically, it means burning in the chest. So, and that is happening because of the acid refluxing back into the food pipe and burning it. But unfortunately, heartburn always doesn't mean acid reflux. There can be some serious conditions, like let's say you are having a heart attack or impending heart attack. It's just getting formed, and you have still not gone into a full blown heart attack, and the symptom can be similar to heartburn. So bottom line is, I would advise, if somebody has some kind of this symptom, heartburn, don't go to a chemist or a pharmacist and say, I'm having heartburn, give me a tablet. You may not see tomorrow if you were somebody who was actually having a heart attack, and you will not be seeing sunrise. Any symptom at any time, it's best to go to a doctor and let him figure out what is wrong with you. The onus is on him. But don't try to self-medicate or go to a pharmacy or some chemist and say, just give me on heartburn for the night. So my advice is, heartburn can happen due to many reasons. Just go to a doctor and they will figure out.
And when it comes to acidity, a lot of homes have these syrups and tablets. I'm sure my grandfather used to drink a lot of it, the pink color one. So is it advisable to take that, or is there a natural way of reducing it?
So first I'll go to the natural ways of reducing it. So if a person wants to get rid of acidity, again it is the same boring things that I'm going to say is, you have to have a good lifestyle, you should exercise, you should not smoke, you should not drink. So it just keeps repeating again and again, but that's how important it is. And yes, your food eating habits matter a lot. The most important thing is avoid overeating. At any point of time, just avoid overeating. Every day morning, just sit before you go to work, just tell to yourself that I'm not going to overeat today, and that is sufficient to have a reasonably healthy life. When does overeating happen? It happens when you skip your meals. So you have skipped a breakfast, you are very hungry, and you overeat by lunchtime. Don't do that. Have your breakfast, have your lunch, and then you will avoid overeating. The second most common fact when overeating happens is in a buffet. In a buffet, you just see unlimited food and you don't know where to stop. So my advice is, if you're going to a buffet, I do that generally. I take a round first. I see everything that is there to be served. Then I mentally think of things I would want to have and things I am not interested, and then just get that on your plate and get done with it. But people start from the first counter and they just keep hogging till dessert. Now coming back to these home antacids that we keep consuming, yeah, they are reasonably safe. They are not for chronic usage, definitely. But as sometimes you attend a marriage or something and you have a stomach upset, you can safely have them. Most of them are safe and for usage, and they are to be used on SOS basis, definitely.
Since we're talking about acid reflux, let me complete this question also. Is there a surgical treatment?
There is the surgical treatment for acid. It's not acidity, acid reflux.
Okay.
There is a surgical treatment for acid reflux, but it is reserved as a last form of treatment. It is not the first choice. So when a person fails everything else, so he is failing these pantocid and omeprazole, he's failing these antacid syrups, what you're talking about, he's failed with his exercise, diet, he's not maintaining a healthy lifestyle, and we have tried everything, and still the reflux is so bad that he cannot pass a single day without having one tablet. So that's when the surgical treatment comes. So it is reserved as a last form of treatment for acid reflux. Just simple acidity, there is presently no surgeries that are recommended. It used to be there long time back, about 7 to 8 decades back. There was a very common surgery that was done called as vagotomy. That's no longer done nowadays because of the introduction of Rantac and pantoprazole. Back then it was not there.
Okay.
So even regular acidities were undergoing surgery that time. That's no longer done now.
Doctor, we're almost at the end of the show. Before we wind up, I want to ask you, since you are a gut specialist, gastroenterologist, what are the common mistakes that we're doing that people actually come for? I mean, it's like you're giving me tips that we should not come to you.
Okay, so what are the common mistakes that people are doing because of which they are coming to me? So the common mistake what I see is that people are eating a lot of processed foods and they are not going back to their regular Indian diet. Indian diet is a good diet, apart from less of proteins, but it's a very good diet. But people are eating more of maida these days. Everything is in maida, and maida is something, as a gastroenterologist, I am very against maida. An occasional piece of pizza is fine. That's fine. But it is not to be consumed on a day-to-day basis. It is just going to constipate you so bad that you are eventually going to develop some piles or something, and you are going to visit a surgeon for it. Smoking alcohol is on the rise, and it's not helping, definitely. I also see a lot of people who have night shifts. They're working for US companies, so they say I get up at 4 p.m. go to bed at 3 a.m. The schedule is all mixed up. These people are bound to have some gut problems. So my advice is, either you go on site, you just move and maybe you work there, or if possible change the job. You just cannot last like this.
Okay.
Working in night, sleeping in day, working in night, you are just eventually going to contract some conditions like thyroid, diabetes, hypertension. Something is going to get to you, so you cannot do this. So I see many of IT people having this odd working hours and suffering. Sleep well. You have to sleep 6, 7, 8 hours. You have to sleep, and that helps in your gut health also. And exercise. There's nothing like exercise. You have to give it time. When I say exercise, I don't want you to imagine going to gym and lifting weights. That's not needed. Do something for 40-45 minutes a day where you actually sweat. That's all that's needed.
Thank you, doctor, for sharing a lot of information. Thank you so much.
I hope it was helpful.
Definitely. Thank you.